Look, our third and final project that you're researching is all about the ulceration that happens inside the mouth when you have radiation. So can you just explain what the problem is and what you're hoping to do to address it and alleviate suffering?
Absolutely. From our experience and countless others in speaking to those who undergo, in particular, chemoradiation for head and neck cancer, one of the biggest challenges for them is is what we call oral mucositis. And essentially what that means is just ulceration and redness in the mouth, which on surface level can sound, a lot of us have had ulcers before, which can be incredibly uncomfortable. But for these individuals, it's unbelievably painful and commonly reported as the most difficult side effect of these treatment regimens. And so what we want to do is hopefully reduce the occurrence of the severe oral mucositis experience, which will then allow a flow-on effect of things like nutrition, which we spoke on earlier.
Can I just say again, for anyone watching this who hasn't had their treatment yet or family of head and neck cancer patients, I did have this ulceration. I describe it to as severe swelling. It was just an extraordinary experience, to be honest with you. But radiation oncologists, as well as being responsible for the supervision of every aspect of the delivery of radiation, they're also in charge of your pain relief. And again, I want to pay a credit to my radiation oncologist who managed my pain so well and increased a range of pain relief that I got throughout this. So they are great at helping us cope with it, but there's no way it isn't a very uncomfortable experience. And also it does affect, again, your capacity to keep eating. So what are you aiming to do? It's something to do with the microbiome in the mouth. So can you explain what you're aiming to do, but also explain what microbiome is?
Yeah, absolutely. So I feel like in 2025, we're increasingly hearing the term microbiome and its impact on not only our gut, but just our systemic health. It's usually talked about with regards to our gut. However, like it or not, our mouth is full of bacteria, but not to say that's a bad thing. Obviously, the microbiome can be really good, full of those sort of healthy bacteria. However, with radiation in particular, and it's why we see oral mucositis so much in these patients, because it's directly targeted at the oral area, radiation, unfortunately, also can indiscriminately kill those bacteria, all those microorganisms which reside in the mouth. And unfortunately, again, the more pathogenic bacteria, so the bad bacteria, are more robust than often the ones left behind. So once it's cleared out from all those healthy bacteria, we see an overgrowth of these negative bacteria, which are known to be involved in the manifestation of that oral mucositis and that severe ulceration.
I see. So what's your hope that you'll be able to achieve? Will it be something that people take or?
Yeah, so this work is quite preliminary. However, what we're looking to do is positively influence the microbiome of the mouth. So essentially, much like people may take probiotics for their gut, apply a probiotic to the mouth to maintain that healthy oral microbiome and prevent the outgrowth of those the bad bacteria. And so what we then hope is that will sort of alleviate some of that severe oral mucositis. And yeah.
And again, for people in treatment now, before hopefully this is successful and there's an alternative, we are given instructions about how to wash out our mouth and keep. Oral hygiene is a huge focus during treatment. And is it bicarbonate of soda mixed with water? Is by memory. We're forever gargling ourselves. So you have nurses and dietitians, all sorts of people helping you. But Connor, I can't say how excited I will be if your research is successful.